about positive things.
It's put an impact on my life.
Mental, physical, social, economic, and spiritual. If one aspect is off in a man's life, he's not completely healthy.
Project Brotherhood is about positive things.
It's put an impact on my life.
Mental, physical,
Looky here, everything you need to fight the disease. So let's get strapped up and let's go. Welcome to the Project Brotherhood Show. I'm your host, Steve Hughes, along with Dr. Tom Mason, Dr. Pete Thomas, and Executive Director Marcus Murray, and our community rep, Mr. Anthony Lockhart. We are Project Brotherhood. Say hello to the people, gentlemen.
Hey, what's going on out there?
Good morning.
I was waiting for your hello.
yeah. I do that hello on somewhere else. Hey, you know what? Let's do the intro. Let's talk about who we are first of all, and why we're here today. We are Project Brotherhood, and we're working at a clinic on the south side of Chicago. It's a social and medical service that we do for African American men. I think maybe we should start talking about that a little bit.
Sure. Project Brotherhood is a clinic designed to provide medical and social services to black men in Chicago. We're on the south side of Chicago, 63rd and Woodlawn. And the reason that we started Project Brotherhood is, black men have the lowest life expectancy of any racial group in this country. We live on average 15 years less than white women. We have the highest rates of cancer, highest rates of high blood pressure, highest rates of diabetes. And, about 13 years ago, some people asked why. Why do black men have the worst health outcomes out of any group? And as a response to that, we'll talk a little bit more about those reasons, but as a response to that, Project Brotherhood was created. And we don't just address the medical aspect of men, we address the whole man. We address the social piece, the economic piece, the spiritual piece. We know that to get men healthy, it takes more than just a prescription. We have a team of black docs, one black female, four black male docs. We can treat hypertension, we can treat diabetes, but we want to prevent it. And the way that we prevent it is we do outreach. And this is one of the ways that we're reaching out into the community right now, is to talk about health, how it affects black men. What are the things that we need to be thinking about to stay healthy? I'm Dr. Thomas Mason. I'm the co-medical director, Project Brotherhood. I'm an internal medicine physician, which means I treat adults primarily. We also have a family practice doc, Dr. Lionel Barbarouse at Project Brotherhood. He treats the whole life spectrum from kids to adults, can deliver babies as well.
I was about to ask you for your birthday and your sign with that nice introduction. But Dr. Mason hit it right on the head. That's what we do at Project Brotherhood. We take care of brothers because black men die early of preventable diseases. The 5 leading causes of death for black men are all preventable. Right.
And you know what? That brings up a very noted quote. In 1966, a quote was made of all forms of inequality, injustice, and health, it's the most shocking and the most inhumane. You guys know who said that?
Dr. King.
Yeah, King.
That's right.
Yeah.
Dr. King said that in 1966. So, let's talk about that, in terms of health. First of all, what is health?
Yeah.
How you describe that?
Well, Project Brotherhood's definition of health is that health is a state of complete mental, physical, and spiritual well-being, and not merely the absence of disease. Now, that was taken from the WHO definition, but we added the spiritual piece to it. And I think the piece to that is that it's not just the fact that someone doesn't have diabetes or doesn't have high blood pressure that deems you as healthy. So if you're a man and you don't have a relationship with your children, that's going to breed an environment for ill health. If you are a man and you don't have a job, if you don't have a social network around you to support you, then that's going to breed an environment of ill health. And so Project Brotherhood acts as that environment that supports you, whether it's physically, mentally, or spiritually. We provide a venue for you to get a job, to come in and get trained for a job, to get a haircut, and then of course come in and get regular physical checkups and find out if you have any sort of medical problems.
And like Dr. Thomas just said, if you don't have a job, it's hard to think about a medical condition that doesn't cause you any symptoms, and to think about, how that can affect and impact your life. we understand that there's things that are going to be more important than thinking about a lot of things that you're feeling fine, you're feeling well,
So health ain't just, just popping pills and something? I mean, you're saying it's encompassing a lot more.
I don't know, Mr. Lockhart, what do you think?
Yeah, you're a community guy. Tell us.
Well, when I think of health, I think about, you got to get out there, you got to eat right, exercise, watch what you take in your body. The main thing is to get your exercise in, eat right, and
Do you exercise?
yeah, I exercise about 4 to 5 days a week.
Why? I mean, for real, why?
Well, first of all, I like to look good. That's the main reason I exercise.
I can't comment on that.
Plus, it's a great stress reliever for me also.
That's good. I think stress is something that we should talk about because I think stress is killing us.
Yeah.
I mean, it's killing the whole. I don't care if you're making, $500,000 a year or $500 a year. I think stress is killing black men.
What causes stress for black men, though? Let's look at that, too. We have to look at the symptoms of stress.
Well, you know what? First, I want to put out to the listeners out there, I want you guys to know I have 2 professional doctors here and also an executive director from an organization. If you guys got questions, you can call in, too, and I'm going to give you the call-in number. The call-in number is 773-928-9230. Once again, that number is 773-928-9230. And then also we're on Facebook. If you can join our Facebook fan page, you can put questions up there. We're going to answer questions later on in the show. And then also you can listen to us live on www.106realradio.com. Once again, that's www.106realradio.com. And then also visit our website, www.projectbrotherhood.net, which is all one word. But I want to go back to what you guys were talking about in terms of stress. But before we even get there, I mean, this organization's been around for a minute, okay? I mean, it started off when?
November 1997.
All right. Now, what were guys dealing with back then? I mean, was it the same thing?
Well, that's some of the same issues that actually black men, all men are dealing with. First of all, men don't like to go to the doctor.
Right.
Unless it's broke, we're not going to fix it.
Right.
Unless it messes with our sexual organ, we're not going there to seek medical help.
Good point.
There's a variety of reasons. The healthcare system isn't set up for men. If you walk into the typical clinic, you're seeing women's magazines, flowers on the wall. You walk into Project Brotherhood, you're seeing black pictures on the wall. You're seeing Muhammad Ali, Michael Jordan, 85 Bears. So just the environment, per se, is set up differently. Also the time at Project Brotherhood, if a brother has a choice of taking off work and miss getting paid to come to the doctor, he's not coming. Yeah. So Project Brotherhood, we set up the time from 4 to 7 p.m., which allows brothers to come in after work, see a doctor on site, they could walk in. And just seeing brothers that look like them, that talk like them, that sound like them, makes a difference. We treat them right. We created a safe place and show them love.
And Marcus, to your point, but that's not rocket science. It's like people act surprised as if when you create an environment that men like, that they will be there. So it's like so when you create the barbershop vibe, all of a sudden here they come. If you create the environment where men want to be, where men see themselves, the providers, everybody has on Project Brotherhood shirts. I mean, it's an environment where it's very male friendly, and so when people come in from various health agencies and they're trying to figure out, well, what is it about Project Brotherhood that works? And they look and they say, oh, I see now. So they created an environment that men want to be in.
And one of the other things, too, is we don't just treat disease. We don't just have doctors there that give out prescriptions. We have a social worker there to address a lot of the social issues that may be preventing guys from coming in and being concerned about their health. Like we said, lack of jobs. We have a range of services to help people get email addresses, to help people get to apply online for jobs. We have stress management courses. We have fatherhood courses. We have rites of passage courses. So we understand that it takes more than just the medical component to get men healthy.
And then one aspect to remember, I think this is the key aspect. It's not like as health professionals, we went out there and said, look, brothers, this is what you need. We actually asked the brothers, and that's what people don't do.
So you gave them a voice.
Right. We had 13 focus groups with all type of black men, rich, poor, short, tall, fat, skinny. and said, why don't you come to the doctor, and what are the things that you need to make you come? They said what they wanted, and we built it, and now it's rolling.
And here they come. Go ahead.
You know, the first thing I noticed when I came into Project Brotherhood is that, you know, it was all black doctors, nurses, and that's something I had never seen going to any other type of places, and that gave me a much more comfort level when I saw my own people helping me.
Yeah, that's one of the things that the men said in the focus groups is that they didn't trust. They didn't feel like they trusted the doctors that they were seeing. The doctors didn't relate to them. The doctors didn't understand where they were coming from, and so that was one of the things we tried to put into incorporating into the Project Brotherhood.
Okay. Well, you know what? One of the things. Hey, maybe we should take this call. We got a call on line 1. Yana, I believe. Is she there?
Yes, I'm here. Good morning.
Hi. How you doing? Good morning, Yana. You're listening to Real Radio with Project Brotherhood. How's it going?
Everything's good. How are you guys?
Great.
Good. I had a question about the program. Well, I do know a little bit about the program, and I know that you guys do preventative treatments and so forth, but you guys also have a program where you do outreach to possible drug addicts. I actually know someone that came into the program that has an addiction, and I wanted you guys to kind of talk a little bit more about that aspect of the program, about how you help those that maybe have an addiction and what you do to try and help them combat that.
Right. Well, I mean, I know that, and being a strategic planning director, Project Brotherhood, I know that there are different organizations that we reach out to that have gentlemen who are battling addictions and other lifestyle difficulties that they're having. And often we do that as a regular in reaching out to different shelters as well as different organizations to attract people to come into Project Brotherhood.
I think one of the things to remember, the word on the street is Project Brotherhood is a safe haven. So it's often people come in there with social problems, whether it's narcotics or whether it's just some mental issues. And besides us serving as a referral site, we do have people on hand to address those issues. So like we were saying earlier, health is different than just medicine. So being addicted to some type of narcotic, we want to address that and deal with that as well.
And in many cases, what we find is that the addiction is not usually the problem. That's usually a symptom of the real problem. And so what Project Brotherhood tries to do is to get down to the real issues. So that's why we have mental health professionals there, master level social workers to deal with the underlying issues. Now, yes, we will refer that patient on to a place if they're not already getting treatment for their addiction. But the main issue is what is causing the person to be addicted or wanting to self-medicate with alcohol, drugs, crack, whatever. And usually there's some underlying medical problem that the person doesn't even know. A lot of times people, they don't realize what medical issues that they're dealing with until they're over their addiction. All of a sudden they realize, oh, my back is hurting, I got high blood pressure. So we try to address all of those issues with the social worker medical piece as well as the referral to the substance abuse place.
And one important thing to mention also is that Project Brotherhood is a part of the Cook County Health and Hospital System. We are located at the Woodlawn Health Center, which is one of 16 health centers, one of 16 ambulatory health centers within the county system. So that also means we have access to the county specialty services. So, we can refer people to substance abuse counselors. We can refer people to cardiologists, to nephrologists, to kidney doctors at either Providence Hospital, Stroger Hospital, or Oak Forest Hospital. So I just wanted to mention that as well.
Okay. Now, we know African Americans and other cultures, it's really an economic issue if you kind of boil it down a little bit. But we know disproportion in terms of people going to the doctor, black men going to the doctor if there's a problem. We're rated #1 in prostate cancer. We're rated #1 in some of these STD infections. We're rated #1 in heart disease. I mean,
very few things that we're not rated #1 in terms of disease.
Yeah, that's unfortunately that's one of the sad things that we have to claim that we're #1 at.
Right.
But with all those different aspects of health going wrong in African American families, what is something that Project Brotherhood is doing in terms of outreach and trying to attract men to come into the clinic?
Well, I think one of the most important things is we're getting the message out there. We meet the men where they are. We don't just wait for guys to come to the health center. We're out on the basketball courts. We go out to the softball tournament every summer. We're out on Lakeshore Drive, you know, talking about Project Brotherhood, passing out condoms. So we meet the men where they are, and a lot of it is health awareness and health education. You know, we don't get these messages in our communities. You know, other folks have it, you know, within their household, within their network, their family structure, but a lot of times we don't get these messages. We don't know what's a normal blood pressure, what really is diabetes, what really is cancer. You know, there's a lot of myths out there that Project Brotherhood dispels and tries to create an environment where we're getting the message out. Two, we provide a place for access. A lot of people just don't have access to medical care, a place to go where you can get a primary doctor that you can see on a regular basis instead of going to the emergency room. So that's another thing. Two key things is access and health awareness out into the community instead of just it being inside our health center.
And participating with the community. And I really actually thought one of you guys were going to say, hey, examples like this radio show. I mean, this is one of our outreach efforts that we're doing.
And it's health. I mean, this is public health on the radio. It's not like, okay, you know, in the exam room, that's cool. But what you've done when you retreat to the exam room, you've allowed the room for death and disease to take its course. And then all of a sudden, now you're dealing with a patient who's really, really ill, as opposed to, let's say, if we're doing this show right now, we're talking about eating a diet that's high in fiber, low in fat to prevent cancer and heart disease. Then now, who are we reaching that could prevent, you know, a potential situation from happening, relative to them developing cancer or heart disease? So it's important that we do things like this, and it's not rocket science. It's in the literature. Public health knows that this works, but the question is who's going to have, you know, the intestinal fortitude. I was going to say something else, but
that was a nice big word. I like that.
I translated Moss to intestinal fortitude to actually, you know, to challenge, you know, our system and say, look, you know, I know, you know, healthcare professionals, we feel comfortable in our little, you know, cocoons, but we got to get out of that if we're really trying to make a difference in terms of getting people healthy.
Well, let me ask, and hold on to that point. We know that African Americans, and they're dealing with all these different problems, but let's deal with some age groups here. Let's go from 18 to 24. What's the #1 cause of death there?
I mean, you could branch it out even higher. You could go 16 to 35. The #1 cause for death for white males is car accidents. 16 to 35 for black males is homicide. Homicide. That's what we have to worry about from 16 to 35. We don't have to worry about car accidents as much as we have to worry about.
Right. So now that's probably like a lifestyle thing, I assume.
Nah, that's a preventable disease, though.
Yeah. And
how do you cure homicide? Education, jobs, opportunities.
Yep, back to the social piece. You know, we're talking about health, but now we're talking about social issues that need to be addressed.
Right. And unfortunately, that's something that don't come in a bottle. We can't write a script for it, you know, but it requires for a collaborative effort. You know, a bunch of, you know, health professionals, politicians, you know, business. We all got to get together to say, hey, it's not healthy for our entire community for 16-year-olds to be dying in our streets like that. That can't be healthy. That can't be healthy for your business. If you selling donuts or Burger King, that can't be healthy for you, that your customers are dying in front of your restaurants.
And the other thing too is that we also say that health is political. You know, in addition to the medical, the social, the economic, it's also political. So, you know, we need to know our local politicians. We need to be more active in our communities.
We need to put pressure on these local politicians.
Right. Well,
they work for you.
Well, we need the community to have a voice. So, one, I want to put out there for the community to have a voice. You can call in now on the radio station, 773-928-9230. Once again, that number 773-928-9230. We're also on Facebook. We're taking questions off our Project Brotherhood fan page. And you can also listen to us on 106realradio.com. We got a lot of different places to get access for information. Also able to call in and talk to one of the doctors, ask a question, you know, a health-related question to the doctor. I mean, that's what we got these guys here for. And I know that one of the things that African Americans don't do in terms of going to the doctors because they a lack of insurance. Okay, and that's a very big thing coming up, especially with the Reform Act. You know, we're educated on that. 2014 is a prediction it's going to be a shortage of healthcare workers in the African American community. So we're not going to have a lot of people looking like us to service us, okay? And I think that that's an important thing when we talk about the clinic in terms of how it's welcoming for men to come in. And I don't even know if there's anybody specializing in just working with men. But let's go back to now. Everybody's hearing our voice and they're saying, okay, Project Brotherhood, Project Brotherhood. One, what are some of the things that we've done in terms of notoriety that you know of and I know of that we've done to cause this popularity? I mean, is the media helping us out now?
Well, I think one of the things that we've done, and we're consistently staying true to our message, and that is really stand in the community and stand and keeping a health message within the community. And so oftentimes the media will come to us. We don't usually go to media. They come to us. So of course CNN came to us and wanted to highlight us as one of the solutions to the health dilemma that's happening right now.
That was the Black in America Part 2
Black in America
right?
Part 2, right.
Okay.
That was in 2009, I think. And so when we get approached by various venues to highlight what usually they're highlighting is the fact that we're taking an innovative approach, not more like a retreat approach, but more of a in your face, in the community, because the reality is if the formula was working for black men, then we wouldn't have the highest death rates, we wouldn't have the highest heart disease, cancer rates. And so the idea that we're doing something different by flipping the whole script is the thing that keeps the media coming back for more information.
In the 14 years the Project Brotherhood has been in existence, we've probably done easily 60 national presentations, been featured on international radio, international TV, Museum of Science and Industry, the List Community Hero Award. But besides Jim Wright Award, besides all that, we just save black men's lives.
Right.
That's what we like to do. That's our claim to fame. We love taking care of our people, our brothers.
One thing we did, we looked at the stats and we saw black men had the highest rates of colon cancer. And we said, okay, look, we got to do something about this.
Right.
What are we going to do? So we designed a program. We got funded through the American Cancer Society to help increase the screening rates for colon cancer on the south side of Chicago. You know, a lot of folks out there don't know that colon cancer is a completely preventable disease if you get a colonoscopy. Right. And so a lot of guys in the community are like, a colon what? You know, what's a colonoscopy? So we trained barbers. We went out to 4 barber shops in Chicago, got 8 barbers, and we trained them on colon cancer. What is colonoscopy? What are fecal occult blood testing cards? And if you have any questions about this, please feel free to call in 773-928-9230, where we train folks about how to prevent colon cancer in the black community. You know, we use barbershops to outreach our message. We train the barbers to talk to their clients about colon cancer, and we had them come into our health center for screening. So that's just another example of one of the community outreach programs that we did, one of the grants that we had with the American Cancer Society, addressing some of these health disparities that affects the black community.
Did you say how much that grant was when you first started off?
What's that?
We don't need to talk about the price.
No, but
it wasn't enough. I could tell you that.
But I will say this. One of the things that we do is we try to emphasize the prevention piece, and no matter what we do, and so the educational piece that we did for that was to emphasize the fact that if you eat a diet that's high in fiber, low in fat, eat lots of lycopenes, which are in tomatoes, things like that can help to prevent cancer in general. So if our men, so it's part of the piece is empowering our men. So instead of, okay, you have to wait till you're 50 to get a colonoscopy, slow down. What you eat today will determine your risk for colon cancer. So your next meal will determine your risk for colon cancer. Eat a diet that's high in fiber, lots of spinach, lots of vegetables, lots of fruit, and low fat.
Right. You know what? Let's find out. We got a call on line 1. Knowledge. I think that's his name. Jamie, you plug him in?
Yes.
Hey, welcome to the show, Knowledge. Welcome to Project Brotherhood. What you got to say?
Yeah, I just have a question regarding colonoscopies, and that is, what is a good time for, let's say, black males to try to get a colonoscopy, and what actually is a colonoscopy? What takes place during the colonoscopy?
That's a great question. So first of all, the American Cancer Society recommends that black men between the age of 40 and 45.
What do we recommend?
40. We use say 40. You know, come in to get a colonoscopy. The general population is 50. Now, also very important, if you have a family history. So someone in your family, your mom, dad, brother, or sister had colon cancer or colon polyps, you may need to come in earlier, maybe as early as 25. It depends on what age they were when they got it, and then we usually start screening around 10 years earlier. What is a colonoscopy? Basically, a colonoscopy is a small scope, maybe the size of a pencil and about 2 feet long, that is flexible. It's got a camera on the end of it, and we can use it to see inside the colon. So what we do is we have you come into the hospital. It's a completely outpatient procedure. We give you some medicine so you can't feel or remember the procedure. The doctor has you on the table, and they insert the scope in through the rectum, and they look at the walls of the colon. What are we looking for? Polyps. Polyps are small growths in the line of the colon that can lead to cancer. Not all polyps are cancerous. Many of them are benign.
But all cancers come from polyps.
But all cancers come from polyps. And so if we resect them at that time, we can cure you from developing a cancer, and we can prevent that cancer from happening. 2/3 of all cancers are preventable with coming to see the doctor or getting these preventive tests that can detect them early and prevent them from spreading, and we can just remove them. So that's a colonoscopy.
So, brother, if you come in early enough, between the ages of 25 and 40, and get diagnosed on time, the chances are your life could be saved. The chances of getting that cancer is cured. But even before that, there's a test called the hemocoat test. Well, it's basically you take your stool, you put it on the card, put it in the refrigerator in a plastic bag, bring it back to your medical provider. It's an easy test. And they look for what, blood in that test?
Yep, we look for blood. So sometimes in your stool you may have blood in it, but you can't see it.
Yeah.
Okay, it's called occult blood test cards. Yeah. And they've been proven to save lives, and it's something very easy, like Marcus said. You can
something you could do at home.
Do at home, and then you can bring it to us. We can analyze it. If it comes back abnormal, we can do some other tests that could potentially save your life.
Yeah. Usually when people see blood in their stool, we get this question all the time. If you can see it, it's usually due to a benign cause, like hemorrhoids, like fissures or something like that, little cuts in your rectum. But it's the blood in your stool that you can't see is the one that we're most concerned about. So it's when your stool color your stool actually changes color, like it becomes darker. Then that's usually a indication that there may be some occult blood or some small amounts of blood. That's the one that we're most concerned about. If you can actually see blood, like see red streaks in your stool, that's usually due to a benign cause. It doesn't mean we want you to ignore it. It just simply means it's probably not cancer.
And no,
what's darker though? You know, it's not like I sit and compare my stool to somebody else.
Right.
Like, so like, you know, give another example. What's dark?
So I mean, dark usually means black. I mean, black stools we're talking about, and again, this is always we will take the entire picture into consideration. So it's not just black stool, but if it's black stool, you have a low blood count, you're at the right age group, then we start to say, okay, the bell started to ring, we better,
And black stool usually means that the bleeding source is up higher in the GI tract, meaning that it could be in the stomach.
Yeah.
And now the other thing too is red blood can mean you have cancer too, because if it's red and you have, the cancer cells, when it grows, it can break blood vessels and you can have red blood. So if you see red blood, black blood, or no blood, come on in and get screened for colon cancer, because it's a completely preventable disease.
You got a question, Anthony?
So what is a healthy colored stool?
Well,
what does healthy doo-doo look like? Is it supposed to float? That means you have fiber in it or something, like,
Well, it's funny we're having this discussion about stool, but I mean,
now
it's important.
This one, but go ahead.
but brown is the typical color, but it could be brown, green is okay. But the main thing is to recognize if there's blood in the stool, or if it's black. is when you want to be concerned about that.
And what age group are we talking about here for this colorectal examination?
25 to 40, right? 25 if you got a history, 40 if you don't.
Well, if you have a family history, come in and talk to your doctor, because then it depends on what age we're going to start. But for black men in general, 40 is when we start screening. But like we said earlier, you got to change the lifestyle. Like at 18, 16, 17, 18 is when you really start the prevention process, and that comes in how you eat. What are the things you're going out to eat every day? You know, what are the things in your community where you can eat? Those are going to determine if you get colon cancer 20 years later.
So in our community, we need to get checked out, because all we have is fast food places, no grocery stores.
Well, we got grocery stores.
Well, a good grocery store.
Well, I think that now in their lives the issue.
Park, I do.
In their lives the issue about social justice, and like we talked about, so Project Brotherhood taking the social justice approach, which is stand on our politicians to say we need the same equal access to fruit and vegetables as they do in Lincoln Park. You
live in Woodlawn, by the way. You don't live in Hyde Park.
Well, if I walk across the street, I'm in Hyde Park.
What is my race eating that's different from another race that's calling us to be the lead in all these diseases?
That's a great question. Foods that are high in saturated fats, fast foods, things that are fried, are so much more convenient to get in our communities.
And cheaper.
Yeah, and cheaper than other communities where, it's a much more emphasis on fresh fruits and vegetables, cooking, healthy meals. The access to those things are much greater in other communities as opposed to urban communities.
Right. Well, I know that at the top of the hour, we're going to take a break and do a station identification, and then I think we're going to go to a song, and then when we come back, we're going to talk a little bit more about Project Brotherhood and some of the things that we're doing. Also, as we go out the intro, I want to put the address out there: 6337 South Woodlawn.
The neighborhood where you stay.
Yeah, well, across the street in Hyde Park. So 6337 South Woodlawn is where Project Brotherhood is located, and we're talking about this Thursday night program that we do from 4 p.m. to 7 p.m. So I definitely want to put that out there. Are we ready for that? We're ready to go? All right, let's go to that commercial. Station identification.
This is Real Radio 106.3. WSRB and WSRB HD Lansing, Chicago. WYRB HD2 Genoa, Rockford, DeKalb.
Come on, walk with us real quick. Yeah. Left, right, left, right. I'm walking, my block.
Right, welcome back to 106.3 Real Radio with Project Brotherhood. We're on air with you guys. I think let's go to some of these calls. We got some calls coming in, and that's encouraging. You're on the line, caller.
Hey, how you brothers doing this morning?
I'm doing wonderful. How you doing, brother?
I'm all right. I got a couple questions for your community rep, Mr. Lockhart. What made you come to the Brotherhood? What inspired you to come? That was my question.
Well, what inspired me to come was, like I said earlier, seeing all these black men helping people. That was inspiration for me. I had been to other medical facilities where you didn't see your people there, and like I said, you get more of a comfort level when you're dealing with your own people.
I understand that. And another thing, you say you work out 4 to 5 times a week, brother. Where do you find the time?
Well, I just kind of make the time, I get up, I do it before I go to work. Sometimes I do it when I get off of work.
Man, more power to you. Y'all brothers, y'all keep doing what y'all doing. It sounds like y'all doing something real positive. Y'all have a good day.
Thank you, my man.
Yeah, thank you. I definitely appreciate that. We got another call? Let's go to that second caller. You on the air, caller? Are you there? Anisha on line 3? Is she there? Tell you what, go ahead. I think you were going to respond to Bob or something.
No, I was actually going to say, I was actually going to ask Mr. Lockhart a good question. Since he decides to work out at 4 or 5 times a week and he is a working brother, how do you make the time for it? Like, what did you have to do to start? Like, what was the thing that made you say, I need to do this?
Well, what motivated me was seeing older men in my family having health problems. Like I had an uncle who had a stroke and a heart attack. I know he didn't work out. I know he was stressed out working. I had a couple partners who had turned 40, and we were all in great shape when we were in the military. And they were out of shape, complaining about arthritis and, too fat and, just breathing problems, and, at 40 years old. So that was the key to me to maybe I need to change my lifestyle.
I mean, here's the thing, too, brother. I'm just going to keep it real. I feel as though I need to work out before I go work out. I don't want to come into the gym. I used to be able to bench press about 270.
When you were what?
When I was about 22. Now I probably can't bench press 40 pounds. So, you see, I don't want to come into the gym and not be able to, like, bench press 40 pounds and have brothers and sisters laughing at me. Like, how do you get over that hump of being out of shape? And, what is it like inside that
Well,
place?
a lot of people feel that way, but when you go to the gym, there are a lot of people there that are out of shape. And when you're there, nobody's there really, critiquing you or how you look, because everybody's there for one common goal, that's to get in shape.
Yeah. Well, there's also exercises that you can do at home.
Yeah.
I know that one of our interns from Northwestern, one of our medical interns, came in and did an instructional class with the brothers in there, and he actually used like this 18-inch ball that he was showing all these different activities that were going on. And
you got to use a chair too instead of the ball.
Yeah, exactly. Yeah. You could do the chairs to do the squats.
Brother,
you could
got
do
Anisha back on the phone.
Oh, Anisha and we got a couple calls on, but the squats are very important.
Yeah.
The dips are very important because these are exercises that you can do
Push-ups.
at home.
Push-ups too.
Yeah.
Push-ups, pull-ups. There's all kinds of things you could do at home. If you want to prep for the gym, you can do it at home.
Yeah.
But I think we want to come back to this point. Let's get to Anisha on line 3.
Very good. Huh?
That was,
Yeah. Anisha, are you there?
Yes. Hey, good morning.
Hey, good morning, Anisha. How you doing?
Anisha.
I'm good. How y'all doing?
Great. Question, comment?
Yes, I just want to say I appreciate what y'all doing in the community, but I feel that the public aid system has failed our race, our African-American heritage, because I know a couple of brothers that's in my community. They go to the public aid to get a medical card, and they refuse them. They reject them. It was a young brother that had high blood pressure, 350, and he couldn't even get no pills, no nothing. They told him, well, they denied him of a medical card. So how can he, get his medicine? You know what I'm saying? And it's been like months. He still has no medical card, and he's only 30.
First things first, tell them to come to Project Brotherhood on Thursday between the hours of 4 and 7 and ask for Mr. Murray. I'll make sure he's able to see the doctor. If he's not able to make it, Tom, what's the website for the county?
You can go to www.ccbhs.org. I'm going to say it one more time. It's a very important website. www.ccbhs.org. And what that site is, that's the website for the Cook County Health and Hospital System, where we provide health care regardless of your ability to pay. I'm going to say that again. Regardless of if you can pay or not, we will see you, take care of you. We can get you medication as well, regardless if you can pay for the meds or not.
And Project Brotherhood's address, once again, is 6337 South Woodlawn. And that's
6337.
Right, Thursday night from 4 to... If he wants to see the doctor, he needs to be there by 5 o'clock. And ask for Mr. Murray, and I'll take care of him.
Right, and you know what, just to add on that, if you have a problem getting there, you can also go to our website. It's www.projectbrotherhood.net, which is all one word, projectbrotherhood.net. There's information on there and how to schedule an appointment, as well as information about what it is that we're doing. Also, we have a phone number, 773-753-5545. Once again, that number, 773-753-5545.
It's also important that we mention, too, that we do accept insurance. We accept Medicare. We accept Medicaid if you have private insurance. We do accept insurance as well. So,
I'm sorry.
And we also have a social worker there that can help facilitate, this gentleman in terms of getting insurance. Sometimes it's just a matter of how the information is packaged. So we'll have him to see our social worker to help him put his package together too.
Okay, I will definitely pass on the message, and I appreciate it. And keep doing good things. God bless.
God bless you too, Anisha. Thanks.
We got the young brother.
Yeah, there you go. And hey, let's go to line 1. I think we got Dwayne on line 1. You there, Dwayne?
Yeah, how you fellas doing today?
I'm doing great. How's it going?
Good. I'm good. I just got a quick question. I actually been a Project Brotherhood before, and I want to applaud you on the great work you guys do. But my question is, what's the age limit for Project Brotherhood? Because I definitely want to come check you guys out, but I'm a single father, so I want to know if I could bring my young son with me.
Well, just recently we added to our team Dr. Barbara Roos, who's a family practice doctor who has the training to see adolescents and children actually. But typically Project Brotherhood is between the ages of 16 and into your 80s. So, but Dr. Barbara Roos is a family medicine physician, and so it would be, if you can call and make an appointment to have him to see when Dr. Barbara Roos is on the schedule, then he could be seen at that point.
Yeah. That's in terms of the medical side. Now, if we often have young brothers come in there from the ages of like 12 to 15 and just want to hang out. Sometimes we'll break out the Wii or the PlayStation and let them play for a while. In the summertime, we'll bring out the basketball, go and put it back in the parking lot, shoot some hoops with them. And it's an amazing thing, young man, to see like doctors who don't, our doctors don't have that much game, but they can play a little bit. Out there trying to shoot ball.
It's amazing seeing the executives get broke down and crossed over.
I had NBA skills. I just got caught up.
You got bad knees, y'all. That's what it is. You got bad knees.
But bring your son, brother. Please bring your son. There's always things to do. Just to see a variety of black men, man, on a positive thing is very important.
And you know what? I'm going to go to Facebook, and I'm going to read a question off for here on Facebook. And the question
thanks for calling, too.
I appreciate it, brother.
He's still there? I'm sorry, Dwayne. Yeah, Dwayne, thanks for calling. Brother, you got the address. It's 6337 South Woodlawn.
You got to pay attention, host.
Yeah, I am, but I'm surfing this web trying to see these questions as well. You know what? Here's a question for Project Brotherhood. Has Project Brotherhood partnered up with any health food venue?
Health food.
I guess they're talking about like the Greater Food Depository or something. In terms of that, no, we haven't partnered up with any food venue. We're a clinic, so we really don't have the place to store food properly. So in that sense, no, we haven't.
Well, I know that we're working with Dr. Terry Mason, and in terms of his food diet, right. And that's the no meat diet. Don't eat anything with eyes, and don't eat anything with a mother and a father. And it's been working very well for him. And I think that we do encourage healthy eating styles. Of course, at Project Brotherhood, we brought nutritionists in, and they've talked about the different food groups and things like that.
And we work with Dr. Angela Oldhams as well, who is noted within the nutrition community relative to food justice. And I think, it's obviously a part of what we think is a huge preventative aspect in terms of promoting health with cancer prevention, heart disease prevention, stroke prevention. It all revolves around what you take into your body. And so a plant-based diet is the way to go in relative to doing that.
I would actually encourage any healthy food venue out there that's listening to us and hear our voice to give us a call at Project Brotherhood at 773-753-5545 and tell us about your products and what you're doing. We're always looking to introduce the African-American community to new and healthy choices opposed to the choices that are in the neighborhood now. And that's a very interesting thing. And let's talk about some of the things that's going to be happening with upcoming shows. I know that we're going to have a special guest next week.
Who's the special guest, Steve?
I don't know. Marcus, do you know who the special guest is?
I'm listening to you. I'm excited. I'm waiting to hear what you're going to say.
Anybody in here know who the special guest is?
No, seriously. We're going to have Common on next week. Chicago's own Grammy Award-winning actor, rapper Common is going to call in.
Right.
Be a guest on the show for a little while.
Right.
Talk about.
And that's our April 10th show. And he's going to talk about what?
Death, hip-hop, life, and health.
How about Serena?
No.
We don't know. We'll still mention that. we'll put that out there. Hopefully we can make that happen too. But I know that we're going to be bringing some of the most noted health professionals in the country, not just in the city of Chicago, but in the country. We're going to be bringing health professionals on this particular program to talk about
a lot
some
of people on this program.
I know. And talk about
spread knowledge for the people on this program.
Absolutely, and an initiative that organizations that are putting out there, that so that the community knows where to get these resources. I think that that's probably one of the most important things, is just like some of the calls that we're getting today, people need to know where to get these resources from, and I think that might have a direct effect on some of the things that we got going on out there. Hey, I think we got another call. You guys ready to go to that? We can go to line 1.
John is on line 1.
All right, John, you there? John, you there? You're on the air live, brother.
Am I on the live?
Yes, you are.
With the great Project Brotherhood.
Absolutely.
Third and Woodlawn.
Absolutely. You got a bad signal, but we hear you fading in there, brother. We get you good
I
phone.
feel privileged just to be able to get through.
Yeah, absolutely.
And if you're in the car, pull over. We don't believe in texting on the cell phone while you drive.
Or driving.
Hey, I got a question.
Sure.
My question is, have any faith-based organizations, have they tried to reach out to Project Brotherhood to do some partnering with Project Brotherhood to try to bring in some of the men that they have in their congregation to seek health care? Because I know you're right next to Apostolic Church, which has a big congregation. Have they reached out to you to see if you could possibly come in and offer services to some of their men who are not insured or who having problems with getting jobs or just need some spiritual guidance? The whole 9 yards. Have they reached out to you, or you have churches all over in the Woodlawn area? Have any of them reached out to you to try to get help from you?
Not at all, but I should mute my button on that question.
Yeah,
Steve,
hit the mute.
There's a church that works with us.
Right. Hit the mute button for Marcus. Yeah, absolutely.
Same thing?
Yeah, we do work with churches. We work with faith-based organizations where they have health fairs, and that we do this screenings for some of their health fairs. So to answer your question, yes, we definitely work with church-based and faith-based organizations with their congregations. Some of these congregations now have ministry, health ministry congregations, initiatives that we're working with. We encourage anyone, and whether it's faith-based or community-based or any base type of organization, to get in contact with Project Brotherhood so that we can help navigate you to a healthy lifestyle. I think that that's probably the most important thing. But to
Brother
go to your
John, I'm about to get in trouble.
Yeah,
yes, we do health fairs with churches. Yes, we go to churches and brothers in the community and reach out to them. But to answer your question directly, no, churches have not brought men to Project Brotherhood for support, and churches really haven't reached out in the way they should to address certain things in our community, whether it's HIV, whether it's cancer, whether it's diabetes. I think the church needs to step up and do more and help out in the community.
I think this is a perfect call, because a lot of people out there right now are driving on their way to church that may be involved with their men's ministry, or their wives may be, or significant others may be involved with different parts of the church. So please bring this up at the church. Say, we heard Project Brotherhood on the radio, a program designed to get black men healthy. What can we do to partner with them?
Because the reality is, your church members are coming to Project Brotherhood. They're coming because they don't have any place else to come. Maybe they have insurance, but they don't. But they're not very connected with their, with whatever healthcare provider that they have. Or maybe they don't have insurance and they're coming. So the idea that this is something that the church ignores in terms of the lack of access of health services within our community is just not responsible. And actually, in the 60s, the church played a pivotal role. I mean, let's be clear. Dr. Martin Luther King, when he said that, his name is Reverend Dr. Martin Luther King. So he's saying that the injustice in health care, of all the injustices, is the most inhumane. And so, as a pastor and as a man of God, I think it's important that they began to take a more pivotal role in getting their members to places that are sensitive to the, to whatever needs that other men have.
And also I want to add, I know there's a lot of good churches out there that do good things, but on the whole, I think the community, and I'm going to speak for the community that I hang out with, sometimes we just want the church to do more in terms of health. Remember, health is also economic. What economic things are the church doing for the community? We know they're doing spiritual things. What economic? What social? What medical? What mental things are they providing for the community?
And another thing to mention too, that the members of the church, the demographics are a lot like the clinics. It's 80 to 90% women, 10 to 20% men.
So why black men stand out?
Right.
Mr. Lockhart, do you go to church?
No, I do not.
Why not?
I'm more spiritual than I am religious.
Right.
Okay, right. That's cool. And the reason I brought that up is that it's not just men that we're reaching out to. We're really, a lot of cases, the women are bringing the guys in to see the doctors.
Yeah, women run it.
So, women out there, if you're listening to this, please reach out to your family, your significant other, and have them come in to see us at Project Brotherhood or to go see their doctor. We just want to get guys healthy no matter what, and we want to outreach in different ways.
I think, Tom, you made a good point, though, because sisters are the backbone to the community. I mean, some of us in here are married. We know that women are closest thing to guys. So if my wife says,
you three are,
hey, go to the doctor,
exactly.
I'm going to go to the doctor,
Yep.
I'm almost 40. When it's time for that prostate exam, she's going to have to kiss me before and after. But I'm going to go.
Right. And you know what? And I want to clarify something. Yes, the church has not marched down with people coming into Project Brotherhood, but I must admit that we have done health fairs at church organizations, and we've definitely helped them with screenings. And the most important thing about screening is that it's just not just doing a screen and saying, okay, we done a prostate screening, and you go out with this illusion that you're healthy.
Right.
We need to get you into Project Brotherhood so we can get a comprehensive, checkup in terms of your total screening. So, but I think the church could be a little bit more involved, but they do, and it's a rigid line. Now, we got probably about 3 minutes before we end up closing out on this show. I want to put a couple things out there. First of all, next week we're going to be on the show again.
That's 8:30 to 9:30 with Common.
106.3.
Okay.
Best believe.
That's it.
All right, and then also Thursday from 4 p.m. to 7 p.m. This Thursday, Project Brotherhood will still be doing our thing. We welcome all African Americans as well as all people to come out during those hours between 4 to 7 p.m. and take part into what we're doing over there and trying to do awareness piece. And you guys got something else?
I mean, part of it is getting around a group of brothers that are committed to a healthier life. And that's the whole piece around going to a gym, just to piggyback off of Mr. Lockhart's comment, is you around people that are all trying to eat right. I mean, we ain't perfect, but at Project Brother, we're trying to promote a healthier life, eating more fruits and vegetables, low-fat diet, exercise as much as you can, keep your job if you got a job, brothers, because that's a part of being healthy. Have a healthy relationship with a
free.
Yeah, and you can come on in and and partake.
And those are all wonderful aspects of the program that we're trying to encourage people to come take part of. I mean, it's our new home, fellas. 106.3 Real Men.
Yes, sir.
Talking about real issues.
I wanted to give some health tips before we leave. I want everyone to know a normal blood pressure is less than 120/80. A normal blood sugar is less than 100 on an empty stomach. That's the test for diabetes. A normal prostate-specific antigen test. That's the test for screening for prostate cancer. If you're over 40, you want to get your PSA. A normal level is less than 4. So these are just a few things that you should know. Just walking around, what are my levels? What's my blood pressure? Yeah. What's my PSA? Yeah. What's my blood sugar level? So, those are things to bring to your doc or bring to us at Project Brotherhood.
And congratulations for the Cubs for beating the Pirates yesterday.
How's those White Sox doing?
We're going to the World Series. I'm not worried about the Sox right now.
Right, and you know what?
Southsider, man. You're supposed to be with the Sox.
Right, and we talked about
Cubs had the first black players when I was little, man.
Yeah, and maybe
I couldn't go over bridge.
That's true.
Back in the 70s, Jack.
Anybody know what the weather's going to be like tomorrow?
Nah, but
okay,
we
all
got
right.
Common on the show next week.
April 10th.
We
Yes,
got
sir.
Dr. Everett back. He's coming off.
That's our
vacation
cardiologist,
in
we're
Miami.
gonna bring a black cardiologist over here. So
Down there surfing in the bottom.
man, all I can say is Project Brotherhood. We're doing a lot of wonderful things out there, and I
Thanks
think.
to Mr. Lockhart for coming on.
And we're doing a lot of wonderful things. So we got 15 seconds to wrap it up. So Marcus, you got anything else to say?
I just like cutting you off.
I'm noticing that, and I can't wait till this 15 seconds is over. All right. So, all right. Hey, thank you. God bless, and come back and see us again next week, April 10th. Common. Come check us out.
Project Brotherhood is about positive things.
It's put an impact on my life.
Mental, physical, social, economic, and spiritual. If one aspect is off in a man's life, he's not completely healthy.
This is Real Radio 106.3 in HD. Listen to us on the World Wide Web at www.1063realradio.com.
Mr. Lockhart, thank you for coming out doing your thing.
Oh, yeah, no, I appreciate it, man. Those comments were great. We should do a push-up contest for Marcus.
I like that, and that was real talk, man. You like, hey, I'm spiritual, not religious.
I appreciate that.
Hey, that apparently you're not scared. You know what I'm saying? So that's good. And